It is Wednesday, May 20th. Welcome to the COVID-19 Task Force Daily Update. Today being Wednesday, there was a meeting of the task force. Lloyd Phillips will report on some of that a little bit later on the program. But to start today, in the last few days, we've been talking about the health check, actually the last few weeks. A lot of work went into it. And today we have some results, and to present that is the Executive Director of the Kahnawake Memorial Hospital Centre, Lisa Westaway. Lisa?
Good afternoon. Thanks, Joe. So just giving a little summary today of the health check, and I would like to talk to you a little bit about the plans for the future with regards to the health check. So firstly, just to give some general details, between April 30th and May 14th, that's when the calls took place, and each call took an average of 9 minutes. There were 825 different households that participated. So this is 825 different phone numbers, and in each of these households there was an average of 2.5 people who were living in the same home. So this brings us to an average of about 2,000 people who were surveyed. This is actually a really wonderful number. It's a good representation of the community, and it gives us a good idea of what the profile is of our community. So I want to just thank, before I go on, some important people who took part in this survey and who actually made the phone calls. I'm going to name them by name because from what I understand, the results of the survey, the amount of people reached, is really unprecedented here in Kahnawake, and so it's some really great work. It demonstrates the dedication of the staff, but also the implication of our community in terms of wanting to answer questions, wanting to participate, and wanting to be a part of this. So that's really positive news. Thank you to Bessie Peltier, Don Lazar, Kayla Patton, Dale Beauchamp, Sir Jarek Philip Gibson, Jessie Daibo, Susan Montour, Elise Mathieu, and Neil McCumber. So all of you really did a great job in making the calls, compiling information, presenting results. Thank you. That's great. So just to go on a little bit more about the results, specifically now, some of the questions that were asked. The first, are you or anyone in your house unwell at this time? 93% said that they were well. 7% said that they had more than one symptom, or one or more symptom, and that they were unwell. So we also looked at risks. So of the people surveyed, what type of risk factors existed for them. And in fact, 48% of respondents were essential workers, or and even though some of them were working from home, they were still essential service workers. 2% have stated that they had come into direct contact with a COVID-19 positive case, but there was another 8% that were unsure regarding their risk factors. So there were 63 of the 2% that had come into, possibly come into a direct contact, or 8% that were unsure if they had come into a direct contact. 63% of those, again, were essential workers or demonstrated higher risk in the job that they do. And nearly 66% of those who came into contact or may have come into contact with someone had at least one symptom. Only 16 people had traveled outside of Quebec in the last 3 weeks from those that responded to the survey. These are a lot of facts, so we're going to have a one-pager, not today, probably tomorrow, up on the website, so you'll be able to consult the results at your leisure. But again, just providing some basic information for today. So symptoms. This is an important section of the survey. 90% of the people stated that they had 0 symptoms. So if you remember just a couple of minutes ago, I said that 93% said they were well, 90% had no symptoms, so there's a bit of a discrepancy of 3% there who ended up having symptoms even though they said that they were well. For those who had symptoms, there was an average of 2.5 symptoms, so it was more rare to have only one symptom. The most common symptoms were headache, runny nose, and cough, all at 38%, 33%, 32% in that order for those 3 symptoms. And for those who may have come into contact with someone with COVID-19, they averaged just 1 symptom per person. testing. So there was an impact on testing from doing the survey. So first of all, the average age of those requiring testing was 52 years old. So our final results demonstrate that the average age was a little bit lower than what we had initially predicted at the halfway mark, where we were in the 60 to 70 age range. And there were a total of 56 people who were tested. So I don't know if you remember, but prior to the health check, we were averaging only about 4 people being tested per day. So over 8 days, that's about 32 people. So this represents a bit of an increase in testing as a result of the health check. And from what we see, there's not any increase in positive cases from the increase in testing. So yes, people have identified symptoms, they have been tested, but we haven't had any increase in positive cases. So what does this mean? Just again to clarify, we reached over 2,000 people. 82% were adults, 18% were children. This is very representative of the community. So we see that generally the community is feeling well. Again, this is representative of those that we spoke to, so we can't say that there are no other positive cases in the community, but we can say that this is representative of the health of the community with respect to COVID-19 symptoms. And so how are we going to use this information moving forward? We've kind of touched upon that a little bit when we talk about business opening and impact to the community as we move forward. How do we measure objectively in order to make decisions about next phases, about increasing social contacts? So the plan is that this survey will be redone 3 weeks after opening of business, 2 to 3 weeks after opening of business. We still need to work out those details. The results will then be compared to the results that we're presenting today. It's very important to present and evaluate those results objectively because they, again, are very representative of the community at this time, and therefore it's safe to say that this is an objective measure for us to be able to evaluate how we should be moving forward as we go through phases of reopening and getting back to the new normal. So I wanted to thank you again, thank the community in general for answering your phone, for sending in your phone numbers. We hope in the next steps to reach even more people, so we're looking at different ways besides just phone calls of how we can facilitate outreach to all of you so that we really continue to get good information that allows us to make decisions that best serve the health of the community. So we'll be getting back to you with more information at a later date. Thank you again.
Yeah, thank you so much. Again, it really is an impressive number of people who participated. So I've been in this business for a long time, and I've been on both ends of the surveys. This one's really good, so go Kahnawake. All right, there was a task force meeting today, and it actually ended just before we got here. So Lloyd Phillips, the Commissioner of Public Safety, will give us this update. Lloyd.
Thank you, Joe. Thank you, Lisa. Yeah, certainly the health check in the community and the number of people that they reached, definitely hats off to that full team, because I think we probably have a better snapshot of the situation in our community than probably anywhere else in Canada. And I think that's a very important piece of the puzzle moving forward, and it gives us a very strong marker in terms of once business reopens and things evolve, what are the impacts on our community? Is it a minimal impact, no impact, or is there a major impact? And this will obviously give us a very strong guidance in that area. But like Joe mentioned, we did have a task force meeting today. Again, many of the topics we talked about were more of some guidance and direction that the task force provides to me to follow up on some individual items. But some of the big discussion today was based on some of the concerns that we've been hearing from community members about the scheduled June 1st reopening of business in Kahnawake. And some of the concerns that were raised was about the increased interaction in the community with non-locals, For the most part, now there's been there has been a restriction from non-locals entering the community, and the peacekeepers and others have been doing their best to maintain that. But once business opens up, certainly in the greater Montreal area, but then the following week, where it's targeted for Kahnawake, what are the concerns being raised is the interaction again with people from outside the community to Kahnawake, especially when you talk about people who increase in the residential areas within Kahnawake, the village proper, but all residential areas for that matter. So there was those concerns raised. There was some discussion on how to properly address that. But again, looking at it from a purely health perspective, we're going to have a further discussion on that on Friday, and then I'm sure there'll be some decisions that have to be made on what is the best way forward in terms of addressing those concerns raised by community members. Just looking at some of the general interactions that have been proven in terms of business openings, at least 15 to 30% more interaction in the best case scenario. If people don't follow measures, obviously that interaction increases. But there's certain things that are somewhat out of our control as things evolve. But there's certain things that we can control in terms of interactions within the residential areas in our community. So again, those have to be looked at very closely, and some more decisions will be made on that in the coming weeks. With that discussion, as we were going out throughout the afternoon and hearing the discussion, and what I'm hearing in different ways is a level of fear. Some of our community are fearful of the unknown, fearful of the next steps, fearful for the health and well-being of our community as a whole. And at the same time, people are fearful of not, of staying where we are. And they're fearful because if we stay in a lockdown state where there's a lot of restrictions, there's more anxiety, there's more frustration that's building, there's more lateral violence, happening, amongst community members. People living in the workplace are getting more and more frustrated, with everyday stuff that normally you would just brush off and it wouldn't be an issue. It seems to be, really getting under people's skins really easy. So, those are some of the things that people are kind of like fearful of, saying, well, if you don't move, if you don't change, these are areas that's going to kind of, really get worse in our community. But yet, as we evolve and we are looking at changing, the way we're addressing the pandemic, there's the fear of, I guess, maybe the health side and more exposure and possibility of seeing an increase in number of cases in our community. So again, as a task force, these are some of the things that we always have to consider, in moving forward. We understand we can't stay stagnant. There's many things happening, behind the scenes. The inspectors, as I mentioned several times, have been out there. Businesses have been calling for inspections because they feel that they are ready now to meet the guidelines for safety regulations, which has been really good. There's been overwhelming support from the business community who are reaching out for advice, for inspections, and taking things very seriously. Because I think there's that general sentiment and that general understanding that we're in this for the long haul, and these are not quick, small fixes, that this is going to be something that we're going to have for the foreseeable future. And some of the discussion that I had with some various business individuals, business owners, and there's a general sentiment across the spectrum that no business wants to be responsible for an outbreak in our community. So they're taking it very seriously. And when one business person mentioned that to me, I don't want to be the guy who's known as an outbreak of COVID in my business, and that really kind of hit home to me, because that tells me how serious people are taking this, and the responsibility that people understand now rests with them as a business owner, but also even more importantly, that rests with you as an individual moving forward on how you're going to protect yourself and how you're going to protect your family. So that's some of the more peripheral type of issues that, as a task force, that help guide us on where we got to go, looking at all the factors and how do we pull everybody along in a way that people feel comfortable, and people's fears are addressed and alleviated. Mind you, we can't get rid of all the fears that people may have, but we can try to mitigate them and minimize them as much as possible by providing factual information and really listening to what the concerns are in the community and finding the best way through it. But again, along the same lines of fear, but also people are also fearful for their jobs. They know if we stay in the current state, what happens and down the road if things remain closed down, am I going to have a job in 2 months or 1 month or 6 months down the road? So people are also fearful of that. And we know we can't keep the level of funding going to the community to support individuals for the long haul. So things have to evolve. And as long as we remain vigilant, we remain safe as individuals, as businesses, and as a community, I believe we can keep that progression moving forward. Only time will tell, but the health check, as Lisa explained a minute ago, is a major, major cornerstone in how we evolve as a community. So again, community, I just want to reinforce the fact that, that old saying that we're still in this together. There is that light at the end of the tunnel. We're going to keep moving. We're going to keep progressing, and we'll deal with issues on a day-to-day basis as they come forward. So with that, I want to say thank you and onigawahi.
Well done and well said, Lloyd. Well, that'll wrap it up for today's program. We'd like to thank you all for taking time out of your busy days to join us. We're here each and every day around this same time, bringing you the daily task force update. Just a little reminder again for those business persons who may not have seen the documents to which Lloyd is referring. You can find them at covid-19.kmhc.ca/forbusiness. And it's all there, very easy to use. That'll wrap it up for us. So thank you again to everybody here bringing you this program, and to you guys. So don't forget, stay clean, stay apart, and if you're sick, stay home. Yao ko adano, onigiwahi.